Well, it's time now for our health report, and joining us now is Africa 54 health correspondent Linord Moudou with an update on the fight against AIDS. Linord.
The United Nations General Assembly has adopted a political declaration aimed at accelerating the fight against HIV and ending the AIDS epidemic by the year 2030. Speaking Wednesday to the Assembly at the opening of the high-level meeting on ending AIDS, UN Secretary General Ban Ki-moon said the world had already achieved the 6th Millennium Development Goal by reversing the spread of HIV/AIDS, reducing new infections by 35% and AIDS-related death by 43%. He says this progress, quote, could not have happened without the leadership of people living with HIV. The political declaration, which was adopted by consensus, reaffirmed member states' commitment to protecting the rights and dignity of all people living with and affected by HIV and AIDS. Joining us now from the United Nations is Sharonann Lynch, HIV Policy Advisor for Doctors Without Borders, MSF's Access Campaign. Ms. Lynch, welcome to Africa 54.
Thank you for having me.
Now, you are participating in the meetings at the UN. What is your take on the political declaration that was just adopted?
I think it's incredibly ambitious in terms of governments represented here by the member states at the UN having signed the dotted line to essentially double the number of people on treatment within the next 5 years. Also, to raise the money needed to do it. So there is a lot to be proud of in this declaration. Now, what matters, though, is tomorrow. The declaration also commits governments to provide immediate HIV treatment to every person living with HIV upon diagnosis. This is a big shift. It is supported by science, but from what is happening now on the ground. Essentially, what's been happening is because of low resources, there's been a rationing of treatment, so that treatment has been allocated to only the sickest of the sick. And now, unfortunately, we have been sending people away from clinic, telling them, even though they're HIV positive, to come back when they're sick. So this represents a big shift. This is a World Health Organization sanctioned recommendation to provide immediate treatment to all people living with HIV, and now member states just agreed to it. So what needs to happen tomorrow is scaling up treatment as soon as possible to every single person living with HIV as early in their disease progression as possible.
Now, in a report released not long ago by MSF, which is called Out of Focus, MSF says that West and Central Africa are basically left behind when it comes to access to treatment and other services. What is happening?
So essentially, there has been a tremendous amount of success over the last 16 years of scaling up ARVs in the public sector in countries. Now, this goes back to the first UN discussion on HIV in 2000. In 2001. At that meeting, there was still a debate whether to scale up HIV treatment at all. Now, the good news is that more people are on treatment than ever before. And in Africa, for the first time, there are more people on treatment than there are new infections. However, in West and Central Africa, in these 25 countries, what we're seeing is that 1 out of 3 people living with HIV do not have access. You should also know that 1 out of 4 deaths worldwide last year occurred in West and Central Africa.
And
what we see in
very critical,
yeah,
because we're going to wrap up very soon. How do we close the gaps, though, between needs and services if we are to attain the 2030 target? Very quickly.
So in West and Central Africa, Michel Sidibe, the executive director of UNAIDS, issued a challenge for member states, for the international community, to triple the ARV therapy initiation rate in West and Central Africa. That's what can happen in West and Central Africa if there's the right amount of political and programmatic and financial support. Worldwide, we know we can reach the targets, but it's a matter of speeding up, scale up, and again, starting tomorrow.
Okay, Ms. Lynch, thank you so much for joining us from the UN.
Thank you so much.
And that was Sharonann Lynch. She is HIV Policy Director for MSF's Access Campaign.